if you and I oftentimes are doing the carpentry pieces, right? The injections, the procedures, the minimally invasive, there is this component of your outcomes will be partly driven on your skill and the problem you have and my skill and the issue we're dealing with, but they're also unequivocally tied to the patient's perception of their pain when they showed up and how long have they had it and the mechanisms that they have to help them recover or not, to prolong the issue of, well, I made it anatomically much better. I got rid of this pathology, but you're not progressing. Why? Dr. Caplan, help us wrap our heads around that entire biopsychosocial, that mental health component that if we don't understand, if we don't vet out in the evaluation and the diagnosis of this patient, the best surgeon, the best surgery still can't have the best outcomes. Walk us through that.
Exactly. And I think that's what's so exciting about Freedom is we do have the opportunity to have those conversations together. And we're really trying to look at what is it that people are coming in with, not just in terms of their presenting pain problem, but aspects of their developmental trauma, their childhood, their coping mechanisms. And how do we assist people then when they have had the best of the best procedure to then actually be able to integrate the care that they're receiving? And I think, when we're thinking about the spine, I immediately start to think about the autonomic nervous system and people who have a tendency already to go into fight or flight, or they go into a sense of shutdown, collapse, and that's all on an unconscious basis. But we can teach people skills to shift their autonomic nervous system back from fight or flight into parasympathetic or rest mode, which is where they can actually learn to heal. But people often don't know those skills unless they're taught them, but that's something that we can work on together and improve outcomes.
I love it.